Your task is that you are taking history from mother. Mother name is Mrs. Sarah, and Mrs. Sarah has a
Okay.
child. She is Amina. Amina is a 13-year-old girl who has complains that she has a right knee pain and swelling.
Okay.
Now you have to take the history.
Okay. So I have to take history from mother or girl?
Mother.
Okay, fine. Okay. Give me just 1 minute. Let me
Okay, I have no
compose
problem.
it. Okay. Shall we start?
Yes, you can start now.
Okay. Hello, good afternoon. My name is Dr. Fazia. I'm one of the children and adolescent doctor in this hospital. I believe I'm talking to Mrs. Sarah, mother of 13-year-old Amina.
Yes, doctor. I'm Sarah. Amina is my daughter. Yes.
Okay.
Good afternoon.
Nice to meet you, Mrs. Sarah.
Yeah, thank you.
Okay. How can I address you?
You can tell me, Mrs. Sarah.
Okay, thank you so much. So, Mrs. Sarah, today we are going to discuss about Amina's health condition. And during our conversation, I may note down some points. Is that okay?
Yes, okay.
Okay, thank you so much. So, Mrs. Sarah, can you please tell me that how can I help you? What are your main concern regarding Amina's health?
Okay, so doctor, what happened? My daughter Amina, she has swelling in the right knee and also pain. I'm really
Mhm.
worried about that.
Okay, I'm so sorry that it must be very difficult. Can you describe that both these condition arises together or one by one?
I think together or one by one, I don't know. But pain is not that much severe. My concern is about swelling because it is increasing. Uh,
Okay, okay, okay. Can you describe this swelling for me?
description what I say on the right knee, it is swelling. It is hot, some kind of, and it's painful really. Uh,
Hmm,
that is I want to
hmm,
say.
hmm, hmm, hmm. Okay, okay, fine. And is there any skin change over the knee joint?
What I say in the knee joint, there is no skin change occur. But one thing I
Okay,
want to mention
and
you, she has some skin discoloration on her cheek. I think it becomes red when she go outside on the
okay.
sun.
Okay, fine, okay. And tell me about the pain. Like, it is only at the right knee joint, or it is going to
The problem
somewhere
is it's not.
else?
Mm, no, no, pain is not going another else. Right knee pain, and also I want to say my concern is also there is also left wrist. There is she's telling pain. Left knee also telling pain, and also my concern in left wrist there is a very few swelling. That is, it is increasing. Hello, hello, yeah.
Okay, okay. Is it first attack or happened before also?
No, it's not fast attack, but
Is
it
it
is
first attack or is it's recurrent?
it's recurrent
Hello,
means
am I
it's
audible?
fast. Yeah, you are audible.
Okay,
It's
is
recurrent
it
means it's
first attack or recurrent?
What I want to tell you that is a long time it is happening, like 7 weeks. Last 7 weeks she is suffering this.
Okay, okay. Okay. Is there any factor that make her condition better?
Factor means, I have given her some paracetamol, ibuprofen like drugs. Sometimes it's relief, but again come back this pain. I don't think that medication is working.
Yeah, I can understand. Okay. And if I give a scale of 1 to 10,
Mm.
where you will keep her pain? Like
Uh,
1 is least and the 10 is worst.
what I'm to say that the pain is actually ranging on the 5 to 7. When it exacerbates, it's 7, and below it's
Mm-hmm.
5, 4, 5. My concern is it's swelling. Why that is happening?
Okay, okay, fine. Okay. And tell me about her activities that this swelling is affecting her movements.
Yes, she can walk, but with pain, she limping. It's really affecting her daily life. Like going upstairs, she telling Mama, I'm feeling pain.
Mm-hmm. Oh, I'm so sorry. It must be difficult for that. Okay. Now tell me, is there any concern for fever?
Fever is low grade. I have no any that much high grade fever, but low grade fever sometimes with pain come. But with paracetamol, it goes away.
Okay. Any concern for weight?
Yeah, yeah, she has lost weight. I'm really worried about that.
Hmm. Oh, I'm so sorry. How do you know that she's losing weight? Did you measure her weight or just by looking at her?
I have last 7 weeks before that she has like 5 kg lost weight. I have measured that, and also her dress are
Mm-hmm.
losing,
Mm-hmm.
loses dress.
Oh, I'm so sorry. Yeah. Okay. And what about her sleep? Is this pain and swelling affecting her sleep?
She's really nowadays very much disturbs. You know, I feel like her sleep is.
Hmm.
I have not slept with
Yeah.
her. She has a different room, but I think she's
Mm-hmm.
disturbed in sleep.
Okay. Have you noted any lumps and bumps in her body?
No any, despite the swelling, no any lumps and bumps I notice.
Okay, okay. And you mentioned that she has some rash on her cheeks. Please
Mm.
describe the rash. When did you notice it?
Notices, it's present on her cheek, and sometimes if go outside the sun, I think the rash is,
Mm-hmm.
increase. It's visible much more.
Oh, okay. Yeah, okay. Okay. And is it painful?
No, I don't think painful. She's
Okay,
complaining pain
okay.
whole body.
Hmm. Oh, okay, okay. And what about her? Like, is there any preference for any season, like hot or cold season?
No, there is no any preference like that.
Okay, fine. Now I will ask about few other questions related to her symptoms. Like, have you any concern for hair loss?
Yeah. But I say she is now complaining that Mama, I have loss of hair, lots hair losing she is.
Oh, oh, I'm so sorry. Any headache? Have you noted?
Yeah, on and off headache, she's also complaining.
Hmm. Hmm. Any abnormal movements or shakiness in her hands?
No, I don't find any shakiness of her hand.
Okay, okay. Is there any concern for vision?
Vision. Yeah, what I want to say that
Yeah.
she wear glasses, but nowadays she started complaining that Mama,
Hmm.
I have a problem occur. So I think we have to visit the eye
Mm-hmm.
doctor.
Okay, okay, fine. Anytime she complained that her heart beat is becoming more like racing heart.
No, she has not complained racing heart, but sometimes she complained that very few, but it's chest pain. Sometimes she complained me.
Oh, I'm so sorry, chest pain. And this chest pain off and on?
Yeah, sometimes she complain. Yes, I feel that.
Okay. What you did for this chest pain? Have you taken any
And
medical help?
we just go for this chest pain. We have never gone, but for this reason, we the knee joint pain. We visited the GP. He just prescribed this ibuprofen. I told, but it's not working.
Mm. Okay. 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 Fine. Does she have breathing difficulty?
No,
Okay. Fine. And is there any repeated bugs in the chest?
no, she has no repeated bug in the chest. 9 minutes.
Okay. What about her poo?
Ooh, what I feel sometimes constipated. I think it's her normal nature.
Okay. And any concern for pee?
No, I don't think there is any big concern.
Okay. Okay. Have you noted any pallor or yellowness in her body?
Yeah, she's pale. What I think.
Okay. And now tell me about like, is there any other illness in the past?
No, past actually there is no any long-term condition. That is the condition actually she's
Mm-hmm.
suffering.
Is she taking any medication nowadays other than
Just
paracetamol and painkillers?
no, nothing.
No. Okay. Okay. And any operation done in the past?
No, nothing.
Any blood transfusion given to her?
No.
Okay. And did she travel to somewhere in the past,
In the
like
past,
recent
she
past?
traveled. Recently, she has not traveled.
Okay, fine. Okay. And okay, tell me about her birth. How was her birth? Like when you was pregnant with her, how was her birth and pregnancy?
It was smooth, no eventful, nothing happened. Just delivered normal vaginal delivery. Then we discharge and go to the
Okay.
home.
Okay. Dr. Emma, there is a pause between, like, I listened to you after few seconds. There is a
Okay.
pause. Okay. Okay. Do you have any concern for her development, like her walking, talking? Is it okay?
Yeah, I have no any concern, but nowadays just she's losing weight. That is my problem.
Okay. Does she allergic to some food or medication?
No, she's not allergic to food or but some just no nothing.
Okay. And you told me that she's not taking much, she's losing weight. And is there any concern for like GP Mayard, and are you following some new diet doctor nowadays due to this weight loss?
No, we have not diet doctor. I just come to you.
Okay, fine. Okay, tell me about your family. Is there any other family member with a similar complaint?
No, I don't think in family member they have any similar conditions.
Okay. Any other illness in the family?
No, there is no any illness means I have diabetes mellitus or nothing else.
Okay, okay, fine. Okay, and are you and Amina's daddy blood related?
No, you're not blood related.
Okay, fine. Okay, Mrs. Sarah, can you please describe your home for me?
It's nothing special. It's a regular home, 3 bedrooms home.
Mm-hmm.
That's all.
Okay, okay, okay. And have you taken some modification in home as she is having this pain in her and difficult movement? Have you taken some measures?
No, 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 nothing I have taken.
Okay, okay, fine, okay. And has she taken achieved her puberty? Like she has got her periods?
Yeah, yeah, but what? Yes, she has got her period, but I want to inform you one thing. It's really irregular.
Irregular. When did you notice that these are irregular?
I think last menstruation she has seen 3 months back.
Oh, okay, okay, fine. And okay, tell me about her school performance. Have you any
Nowadays,
concern?
she absent school because of this pain, and
Mm-hmm.
I think school
Mm-hmm.
performance now not going smooth.
Oh, I'm so sorry. It must be difficult for you. Okay, and tell me about her relation with her peers. Like how this condition is affecting her.
This condition really affecting her nowadays. She is not that much. She's upset, and I think she's disturbed
Mm-hmm.
some kind of.
Oh, I'm so sorry. Have ever she discussed with you any negative thoughts or any like she feel low?
No, she has never discussed like that. 13 minutes over. I have given you 1 minute extra actually. Now you can describe your history.
Okay, okay, fine. So today I have taken history from Mrs. Sarah, who is the mother of 13-year-old Amina. And Amina, mother has concern that Amina has pain and swelling in her right knee, and she noted it from the last 2 to 3 months, more than 6 weeks. And pain is of moderate intensity, not with no radiation, and the swelling is in her left and right knee and the left wrist also, and it is associated with mild fever and weight loss, and this condition is affecting her sleep a lot, and she has pallor, and some racing of heartbeat and chest pain as well. While her past history is insignificant, she is not taking any medication other than the paracetamol and some painkillers, other painkillers, and she has not been investigated for this condition. Her birth was uneventful. She is developmentally okay, and she is not allergic, and she is losing weight as her appetite is decreased nowadays. And there is no similar illness in the family. This condition is affecting Amina a lot. She is feeling low, and where she has to miss her school most of the days due to this swelling and the pain. And she has achieved her puberty, but her periods are irregular from the last 3 months. She has last period 3 months back.
Okay. What
Yes.
is your top diagnosis? Tell
And
me.
she yeah. So, my according to the history, I will keep my differential diagnosis as connective tissue disorder like systemic lupus erythematosus. I will keep juvenile idiopathic arthritis, and
And
it can be juvenile idiopathic dermatomyositis, and I will on the I will not keep infection here, because there is no history of fever or any um, other constitutional symptoms. So
okay.
my
So your
differential
top.
is systemic lupus erythematosus,
Okay.
JIA, and juvenile dermatomyositis.
So your on top is SLE. So how many criteria you find in SLE
Yes.
in your history? What are the features you find?
And in this, the features are the arthritis in different joints, and history of rash, malar rash, and history of hair loss, history of chest pain. It could be due to pleurisy, and uh, and the history of weight loss and feeling of depression. It could be due to disease itself, or it could be the due to the illness, pain,
Okay.
and
So what
the
are
her periods are also irregular. So all these features are favoring for the systemic lupus erythematosus.
which dermatomyositis you keep on the differential diagnosis? Why not it is dermatomyositis on top you keep?
Because in dermatomyositis there should be a different kind of rash around the eyes. It is heliotrope rash, and it should be
Hmm.
on the shawl sign. Rash should be on the back and shoulders, and
Hmm.
they are with the mostly with proximal myopathy.
Okay. Suppose this is
Rash is
SLE.
different.
Okay. Suppose this is systemic lupus erythematosus. How can you manage this case?
So, after complete thorough physical examination, I will look at the other features, because for SLE we have to make criteria, and after examination I will go for certain investigations, like in the form of I will go for complete blood count to look at the
Okay. What examination you want to do?
hemoglobin,
First
because
tell me. What examination you want to do?
Yeah, in examination, I will look for the major and minor criteria, like a major criteria, the arthritis, arthralgias, and signs of pericarditis,
These are the
pleurisy,
clinical
pleural
features. I
effusion.
said that what examination you want to do. Examination means
Yeah, examination. In
which
examination,
system?
I will look for the malar rash, and hair loss, and
Okay. Then investigation.
signs
Tell
of
me what
pleurisy
investigation
and
you do? What investigation you
investigations.
do?
I will go for complete blood count to look for hemoglobin. There may be anemia of chronic illness, and will look for thrombocytopenia, neutropenia. There may be neutropenia and thrombocytopenia, and CRP, ESR will be both will be raised. And I will check for the ANA, anti-nuclear antibody test, anti-DS antibody test, and both will be positive, and the rheumatoid factor may be positive. And I will look for ultrasound abdomen, chest X-ray, chest X-ray for to look for pleural effusion, pericarditis, and ultrasound abdomen for hepatosplenomegaly, and to look at the kidney status and the complete urine examination, and other are serum electrolytes.
Okay.
Yes.
What advice you give this patient?
My hair advice will be like sun protection, by use of sun blocks, and avoidance of the advice like
So you can't give the answer, right?
no I
Okay. So what medication you give?
So here, the mainstay of treatment is with a non-steroidal anti-inflammatory drug to relieve the pain and to relieve the inflammation, and other is chloroquine. And there, if it is not working, then disease-modifying drugs like in the form of methotrexate, and there are some immunomodulators also, and the steroids.
And what are
Main
the team?
treatment is with chloroquine, steroids, and methotrexate.
What team you involve?
Yeah, I will involve my senior pediatrician. I will involve rheumatologist and immunologist, and physiotherapist, occupational therapist, and ophthalmologist, and rest of the team depends on the complication. If there are chest, if there are lung complication, then involve pulmonologist. If there are some mental complication, then we involve neurologist and the psychiatrist, psychologist, social worker for the social support. And I will liaise with the support groups and daily living allowances, and the lies with the school teacher and the school nurse to inform about the health
Okay.
condition and any home and any modification at the school as well.
Okay. So
And
what
the
are the
dietitian as
diagnostic?
the child is losing weight.
What is the diagnostic
Yes.
criteria of SLE? Tell me the feature of SLE.
Features of SLE are in the face rash, and in the chest pleurisy, pericarditis, and pleural effusion. Actually, I'm not able to remember the whole criteria. There is exact criteria. I can't remember that.
Okay. I think I asked about SLE everything.
Hmm.
1 minute is remain, though your viva. First, I want to
Hmm.
tell you that the your chief complaints was knee pain and swelling. So you need to ask when it first started.
Yes.
Onset, course, and duration. Is it unilateral,
Yes.
bilateral? Then I will tell you 7 weeks. What make it better? What make it worse? Then we go. There is pain.
Hmm.
So pain you can analyze is that 1 to 10 how much you ask about site of the pain. It is radiated. Timing of the pain you
Hmm.
have not asked. Juvenile systemic
Uh-huh.
onset of GIA also we have one DD
Hmm.
with
Hmm.
fever.
Hmm.
It comes.
Hmm.
Exacerbating relieving factors, severity scale you ask, other joint, previous similar
Hmm.
attack,
Hmm.
and also sign of inflammation like it is hot looking, feel. You ask me describe the pain or swelling like that. Generally, then you go the
Hmm.
fever, weight, activity, sleep. Fever you ask, weight ask,
Hmm.
activity yes,
Hmm.
that is. Then other concern is
Hmm.
there any unusual features, long term, any medical condition or any chronic
Hmm.
illness.
Hmm.
Then past history, sorry, systemic review. Systemic review nicely. We have to go from MSK, skin spots, pigmentation, skin lump, skin joint pain, joint swelling, bone pain, hair loss. Lots of questions you have not asked. From GIT, tummy pain you have not asked. Tummy distension, there is tummy pain present. Mouth ulcer you have not asked. If you ask
Yes.
me that is there any oral ulcer, then I will tell that oral ulcer present because oral ulcer is a feature of SLE. Okay. CNS you ask
Yes,
about the
yes,
headache, but
yes.
I told you headache present on and off, but you have not asked me the headache is at the morning time or not. Just you need to know that morning vomiting associated with this headache or not. Okay.
Yes, yes,
Okay,
yes,
unusual
yes,
gait. Eye, you have not asked. Eye is very important. What about her hearing and visions
yes.
from CNS? Because if you
Mm-hmm.
ask me eye, I will tell that the eye is red because some uveitis hmm, that is present in eye. So this feature, some feature you miss,
Yes.
then go hematology, chest pain, you discover endocrine, you ask urinary, you ask P, poo and CVS. Okay. Then past history you ask nicely, everything trauma, treatment, traveling. Okay, it nicely. Perinatal history as usual, puberty. Yes. Puberty, you ask about the menstruation. At the end, you ask, but I have told you 3 months back, her menstruation is irregular. You have to ask that. Is she sexually active? 3 month you need to take. It is really
Yes.
important, sexually active, taking any
Yeah.
protections, OCP,
Mm-hmm.
because she can be pregnant. Her weight loss,
Mm-hmm.
she psychologically depressed here.
Mm-hmm.
So that is you need to exclude. Hmm.
Mm-hmm.
Okay, vaccination as usual.
Okay.
Vaccination, do you ask? She has
I
taken.
thought that will we ask these things from mother, like head's history? We will
Yes,
ask from mother or
yes,
from the
yes.
girl?
Here from mother.
Okay,
You,
from mother
of course,
also.
you have to. I have to.
Okay,
The
okay.
examiner need to know that you know these features.
Huh.
Do you
Okay,
ask
fine. Okay,
vaccination?
yeah,
Jab,
I
you
missed.
ask jab history,
Hmm. Hmm.
vaccination.
Which
Okay,
history?
allergy as usual. You ask
Yeah, I asked.
nutrition. Nutrition you ask,
Allergy.
but how about her appetite? You have not asked me. As she has weight loss, one feature,
Huh.
so appetite you reduce. So appetite is decrease
Yeah.
here. I will tell that. You ask any dietitian involved or not.
Yes.
Development you ask, okay, family
Oh.
history, social school. School you ask performance loss, but any bullying. It's very important here. Bullying you have not asked. So you get
Oh,
one chance. You have
yes.
to ask about the
Bullying.
bullying.
Very.
Hmm. How
Yes. Very
psychosocial effect.
important.
Okay, so
Yes.
lots of point you have
Hmm. Hmm.
missed.
Hmm. Hmm.
Okay, then I am going
Hmm.
to
Hmm.
the presentation. Presentation you take like 1 or 2 minutes. I think internet issue also here
Hmm.
present. But you have
Yeah,
mentioned a
there
lot
is
of
some internet.
use some features like she has headache. You have not mentioned. She has alopecia. I told you. You have not mentioned on the presentation.
Hmm.
Suffering headache, alopecia. Okay.
Yeah.
And depression, you
Ha,
ask,
ha,
you
ha,
tell
ha,
me
ha.
low. She's feeling low. That is depression. You can mention me that she has depression. She's low feeling.
Ha.
Okay. So
Okay.
diagnostic, one thing I have asked you, how can you manage this patient? Management patient first, I already completed the history, then I will do the examination, I will do the investigation, then I will do the management and then the advice. Okay. Examination, what examination? First the
Okay.
vitals, her heart rate, respiratory, blood pressure, everything.
Ha.
Blood pressure need to monitor. Then we
Ha.
MSK examination,
Yes.
neurology examination
Yes.
here. Okay, these are examination. You
Hmm.
are telling me
Hmm.
that's criteria, features are.
Ha.
And diagnostic criteria of SLE are
Yeah.
so brain empty. I will send you on the WhatsApp about its management, everything
Ha.
details. Okay, very easily you will
Okay.
can.
Yeah. Please. Yes. Ha.
Hmm.
Very important.
And
Yes.
investigation,
Yes.
you
So
told me very
yes. These.
nicely. Full blood count, that is pancytopenia. Remember, you are telling me that neutropenia can
Ah.
be anemia, everything, but it is called
Hmm.
one word
Hmm.
pancytopenia. I can find or leukocytosis for
Ha.
inflammation.
Okay.
ESR, CRP increase, immunolysis, liver
Okay.
function test, kidney function test. Then autoantibody, ANA, anti double stranded DNA,
Ha.
anti ENA, anti Smith antibody. These are anti RO antibody, anti LA. These are complement C3, C4 imaging,
Okay.
chest X-ray, very nice. You tell me echo, MRI, brain. And one important
Hmm.
thing,
Hmm.
slit
Hmm. Hmm.
lamp for
Hmm.
uveitis, very important because eye sign present. And also eye
Yes.
sign present in
Ha.
JIA.
Yes.
One of our DD is JIA.
Yes.
So eye sign very important
Yes.
here.
Yes. Yes.
And bedside
Yeah.
blood pressure
Hmm.
RBG.
Hmm.
Advice I will
Exactly.
tell you, I will send you that is diet, exercise, sun protection, avoid
Ha.
nephrotoxic drug, education to the family. I will send the sheet, you will find
Ha.
all this very nicely. Just give a reading, it will be easy for you.
Okay.
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 Then I
Okay.
want to
And
tell
send me
you.
please SLE criteria also.
Yeah,
SLE.
everything I will send you nicely. I have very nice note. So in exam, how can come?
Okay.
First of all,
Ha.
GIA can become, this history can be GIA.
Ha.
GIA come like knee
Hmm.
pain,
Hmm.
like jaw pain, like
Ha.
hand pain, any joint pain.
Ha.
Okay. 6 week regression, remember.
Yes. Yes.
Same style, you will take the
Hmm.
history.
Hmm.
GIA feature, eye
Hmm.
problem present that is a three joint oligoarticular GIA or polyarticular GIA. You have to count how what was our case,
Yes.
oligo or poly.
Our case was wrist and knee. It's oligo.
Wrist knee, two wrist and one knee, three joint involved. It was
One knee.
oligo, yes.
Three
Because
joints.
four
It's
joint or less
oligo. Yes.
oligoarticular GIA, five joint and
Huh.
more is polyarticular GIA.
Huh.
You count when you find this history
Yes.
count. Okay. So it can come
Yes.
like GIA can become SLE. SLE also the chief complaint can be weight loss. Remember the 13-year-old girl, that is weight loss.
Yes.
Remember this come. So weight loss, you know how can
Yes.
we early, how can you know that, hmm, or failure to thrive complaint. Then
Huh.
also once it's
Yes.
come, like I'm telling you, 10-year-old with right hip and knee pain. That was normal, but the differential
Hmm.
diagnosis they keep Perthes disease. They take the right before bell rang discuss on Perthes disease. Okay, so it can be come as a reactive
Oh, but
arthritis
this
and
disease.
related
Huh.
arthritis. So you need if it is high grade fever, acute condition, septic arthritis. These are your IBD related arthritis,
Hmm.
loose motion, constipation, IBD
Okay.
related arthritis. Keep in your mind. Dermatomyositis also can
Yes.
come. Very
Yes.
nice.
Yes.
You ask me, you can ask me where the rash. You have not asked. Just kick rash. I told
Hmm.
you all the positive hints I have given you. You have not searched in the
Ah.
history. Okay, I support you because you
Yes.
have keeps in your mind.
Yeah.
When I say that there is
Hmm.
tick rash, you have to ask me, is there any rash around her eye? Is there any rash on the knuckle of the hand?
Ah.
Right? Remember,
Yes.
you have to
Yes.
search all the
Yes.
DD also keep ready. Examiner will ask you all the
Hmm.
DD. So the
Hmm.
juvenile dermatomyositis also
Hmm.
come on exam. Remember this.
Hmm.
So this is all about this
Yes.
arthritis
Yes.
history. Okay. I'm